Hello guys, welcome back to Pharma Palette. Today we will learn how different drugs stop thyroid hormones. Don't worry, this is not going to be tough, just some easy tricks you will never forget. Before knowing the thyroid inhibitors, we have to know what are the thyroid hormones. There are two thyroid hormones. One is T3 and the other one is T4. T3 is called as the triiodothyronin. It is also called as leothyronin, whereas the T4 it is called as thyroxine. So this is about thyroid hormones. Now let's get into thyroid inhibitors. In the thyroid inhibitors, the first class is called as anti-thyroid drugs. These are also called as the one which inhibit the hormone synthesis. Now how do you remember the drugs which are under this? Just remember one trick. Remember that there was a car, there was a meth bike that was stuck in the traffic, and there was one fan which is called as the propyl fan that is trying to cool them down. Now, what are the all the three drugs under this? So the first one is carbimazole. Second one is methimazole. And the third one is propyl thiouracil. So, to remember the second class in the thyroid inhibitors, they are called as the one which inhibit the iodide trapping. So, these are also called as the ionic inhibitors. Now, how do you remember the drugs under this? The trick here is just imagine that thyroid is a shopkeeper that is not allowing any iodide inside. So, for that, it has kept three boards, three no entry boards. So they are, one is nitrate, other one is perchlorate, and the other one is thiocyanate. So that is about the second class. Now coming back to the third class, it is called as the one which inhibit hormone release. So how do you remember these drugs? So when the thyroid wants to release hormones, imagine that there is one security who is shouting saying that iodine stop. So the sodium and potassium they will be blocking the gate, and the organic iodides they will hold the line. So you will be remembering all these three drugs. One is iodine, iodides of sodium and potassium, and the other one is organic iodide. So that is about the third class. Now coming back to the fourth class, the last class of thyroid inhibitors, which is the one which destroys the thyroid tissue. So here we will be having one radioactive iodide, which is simply called as I-131. So it is a radioactive iodide that will be completely destroying the thyroid tissue from the body. So this is the overall thyroid inhibitors classification. So that's it. Thyroid inhibitors are just pro-meth to stop making hormones, nitrates, perchlorates, and thiocyanates to block the iodide entry, iodine and its gang to stop the hormone release, and finally the radioactive iodide to finish the thyroid gland completely. See, simple. Now you can answer this question without any confusion. So if you enjoyed this video, don't forget to like, share, and subscribe to Pharma Palette, where pharma is never boring.